Today, we're talking about the gut-brain interaction and sleep issues with Dr. Ellen Joseph. She's a licensed clinical health psychologist working at GI Psychology in Virginia. If you are a doctor who wants to uplevel your sleep medicine knowledge, go ahead and subscribe to this channel to keep learning about sleep. I'm Dr. Nishi Bhopal. I'm a physician. I specialize in integrative psychiatry, and I'm board certified in sleep medicine. And a quick note for doctors, before we jump into this video, I'd like to invite you to get my free sleep mini course for outpatient doctors and health practitioners. It's filled with lots of practical tips to use in your clinical practice. The link is in the video description, or you can get it at intrabalance.com/doctors. Okay, Dr. Joseph, thank you so much for joining me today. I'm really excited to dive into this topic of the gut-brain axis and sleep. I think this is such a fascinating area to explore, and it's really kind of at the cutting edge of sleep medicine, of psychology, of medicine in general. So can you share with our listeners how you got into this field and a little bit about your background?
Yes, absolutely. Thank you so much for having me today. So great to speak with you all. My training is primarily in health psychology. So I came from kind of a generalist health psychology background. I was working in primary care, inpatient hospital settings, and I found myself really drawn to folks with GI conditions in both these inpatient and outpatient settings for a couple of reasons. So I think first and foremost, we know that mental health and gut health have such a strong connection. So whenever folks were experiencing these disorders of gut-brain interaction or an exacerbation of a more organic disorder like IBD, having a mental health professional step in felt like such a important place for us to be. And then secondly, there's so much stigma around talking about your gut. Folks don't want to talk about the fact that they're having diarrhea or they're vomiting or they have gas in their belly or they're experiencing passing gas a lot, right? All these kind of parts of our experience that are really stigmatized. And being able to be someone that can step in, have those conversations, help reduce that stigma and help people experience relief, just really excited me about getting into this work. I think a lot of folks with these conditions are suffering in silence for a variety of reasons, and getting access to effective evidence-based care, I think, is so incredible for these folks and something that really I felt so much passion for.
Yeah, and it's so helpful how you mentioned the stigma around gut issues. I hear that all the time from patients of mine where, so I practice psychiatry and sleep medicine, and sometimes patients will mention, I ask them about their gut health, and they'll mention, yeah, I have some gut issues, but I don't want to, I don't know, it's too much information for you. I don't want to disgust you, or I don't want to gross you out with those issues. And I'm like, no, tell me, tell me what you need
Yes.
to know, and this is a place for you to talk about them. And there is such a correlation, as you mentioned, with gut health and mental health and sleep, which we're going to dive into today.
Absolutely. Yes. I even have those in my appointments where folks will go, and it was like a rough week. And I'll say, well, no, tell me what a rough week is. What were those symptoms that came? I think even in these settings where the conversations are welcome, we tend to really kind of dampen them and be a little bit more vague. And I really want this to be something folks can talk about.
Absolutely. And yeah, and also along those lines, I think patients may not be used to talking about these things in a mental health setting or in a sleep clinic setting. They're used to talking about it maybe with their GI doctor or their primary care doctor. But I think as health practitioners in the mental health space, the sleep space, or whatever specialty you might be working in, the gut is so fundamental to overall health and well-being that it's something that we as practitioners can also get more comfortable talking about and asking about.
Absolutely. Absolutely.
Great. So maybe let's explore a little bit about the gut-brain interaction. What exactly is that? What does that mean? And what are disorders of the gut-brain interaction? What's the difference? How do you know if someone has a disorder? So maybe we can talk about that.
Absolutely. So the gut-brain interaction is something that all of us have. So our gut and our brain are constantly in communication. So through our central and enteric nervous system, so central being the brain and the spinal cord, enteric nervous system being our gut, messages are sent all day long. When we feel hungry, when we feel full, when we have a virus and we need to get that out of our body, those messages are constantly occurring. And for some of us, this communication system goes awry for various reasons: genetics, chronic stress, a virus, constipation, diarrhea. There can be a lot of different causes. but this system gets really sensitized. And this is where we get more into a disorder of the gut-brain interaction. Because what starts to happen is those sensations in the gut become magnified and distorted. So what used to be maybe a little gas bubble that's moving through the gut now feels like severe pain or significant distension. And this is called visceral hypersensitivity. So we get really sensitive to those sensations in the gut. And then our brain does what our brain loves to do, which is try to protect us and try to gather information, see patterns, and it starts to really zoom in on the gut and it becomes hypervigilant. And the brain starts to really zoom in, focus on, and search for these sensations in the body, which then feeds into this really vicious cycle. We add in then pieces like comorbid health conditions, comorbid mental health conditions, and this cycle can be even more exacerbated so that folks are really experiencing a lot of significant GI distress, but through scoping and through lab work, there's nothing that we can point to say this is the cause of your symptoms. So these can be really frustrating conditions for folks because they go through this extensive testing, extensive lab work with these really significant symptoms. And then information is coming back saying, everything's normal, your gut looks great. And the patient feels far from normal. So these used to be what we would call like our functional GI disorders. So think like IBS, functional dyspepsia, functional nausea or vomiting or constipation. This can involve the upper and lower GI tract.
That's really, really helpful. And so, yeah, and I think you highlighted an important aspect there, which is that patients get all this testing done that is comfortable, it may be painful, it may be expensive, and then they're told, no, everything looks good. And they may then feel like, well, am I making this up? Like, is this a real thing that's going on? Is there anything that can be done about it? And that's where that anxiety or hopelessness can start to set in.
Absolutely. And interestingly, probably about 40% of adults and about 25% of children will meet criteria for a DGBI at some point in their life. So these actually are incredibly common, but also conditions that can feel very isolating because of that confusion. And also, I have nothing to point to here. So now what? What do I do with this? I'm still just as uncomfortable as I was when I started.
That's such a huge number. I didn't realize it was that high.
Yeah, it's really high.
So let's talk about sleep and how sleep interacts with the gut-brain axis and how DGBIs interact with sleep. So could you give us kind of like a nice high-level overview of that correlation?
Absolutely. So I like to think of this relationship as bi-directional. When we don't feel good in our gut, it's hard to sleep. And when we don't sleep enough, we don't feel good in our gut. And this can kind of come through in three different areas where this relationship can occur. So we think about hunger and satiety cues, depression, anxiety, as well as pain. So first and foremost, any of us on this call, for those who do not have a disorder of gut-brain interaction, many of us don't feel great the day after we don't sleep well or we wake up too early in the morning. I know I myself can feel really nauseous in the morning if I wake up way too early, if I have to catch a flight or something. For someone with a DGBI, that nausea can be completely magnified and distorted. This person might experience vomiting. Their nausea might be so severe they can't get out of bed. And that relationship is really, really problematic for that person. This also impacts their feelings of hunger and fullness. So for those of us without a DGBI, we might notice on those days with less sleep, we're kind of craving more of those carbs or more of those sweets to give us those boosts of energy that we're lacking from our sleep. For someone with a DGBI, that might actually come across as nausea, and they feel totally uninterested in eating food, which we also know can then exacerbate the nausea even more when they're super hungry. So those hunger and fullness cues can get completely thrown out of whack when we don't get enough sleep. And then when we add in the DGBI, it can be even more problematic, the symptoms we may feel. Depression, anxiety is another big area. We know that when we don't sleep enough, that can be a platform for which depression and anxiety can worsen. It's harder for us to manage stress when we haven't slept enough. And we also know then when that depression and anxiety are worse, that can also feed into symptoms of your disorder of gut-brain interaction. It can exacerbate those symptoms and kind of feed that stress cycle. So again, that relationship can go back and forth. And then finally, pain. So pain, when we don't sleep enough, can also be exacerbated because we don't have enough resources left mentally. We're not feeling good physically, that pain gate opens up and we feel it more intensely. And then, of course, when we feel more pain, it's harder for us to sleep. It's hard to feel that sleep onset at night because we are so uncomfortable. So these relationships are very bidirectional and can be very much exacerbated in the context of a disorder of gut-brain interaction.
It's really, really helpful. And we were just speaking before this video about studies on the microbiome and sleep deprivation. And there was a really interesting review that came out last year looking at sleep deprivation and specific changes that happen in the gut microbiome, dysbiosis, and also leaky gut and inflammation and the interactions. And one of the things that they proposed was really working on the sleep piece to help improve the gut health. So there is that bidirectional relationship as you were describing. And I think also just I wanted to highlight what you were describing about feeling nauseous when waking up too early. I was literally just talking to a patient of mine yesterday about this who has a circadian phase delay. And we were discussing this very thing, that waking up too early or during that sleep zone that's not aligned with her body clock would cause physical pain, physical discomfort, and extreme nausea. And I also experience nausea if I wake up too early. That's when it's not aligned with my sleep zone. So there are these real symptoms that people experience when they're experiencing sleep deprivation, or if they're sleeping in times that are misaligned with their body clock.
Absolutely. And we live in a society where, and probably many folks here on the call, and us included, where sleep can be the first thing to go at times, right? When we have really busy schedules, we're trying to fit everything into our day. That's where we start to cut time out. And folks will often hear like, yeah, my provider's telling me I need to sleep more. Yes, I get it. But truly, getting more sleep can have such a positive impact on so many facets of our life, including our gut microbiome and our ability to manage these different sensations in our body.
Yeah, and also just validating it for patients. Because again, it's not something that a lot of people have heard about or are talking about, or they may not be discussing it with their physicians. So for you listening as the healthcare practitioner, inquire about these things. How are you sleeping? How is that affecting your digestion, your gut health? Are you experiencing any issues with that? Gas, bloating, diarrhea, those kinds of things, because these are all highly treatable things. And maybe we can talk about some of those treatments. What are some of the interventions that are shown to be effective for these DGBIs, or disorders of the gut-brain interaction?
Absolutely. So our two kind of gold standard treatments for DGBIs are gut-directed cognitive behavioral therapy and gut-directed clinical hypnosis. I'll make a note that the American College of Gastroenterology has actually listed these as our gold standard first-line treatments for IBS, which is one of the many DGBIs that falls under that umbrella. I will note folks who utilize these treatments, gut-brain therapists, their training is very different from a community mental health provider. So if your listeners are kind of referring these folks to somebody in the community who uses kind of your bread and butter CBT, these treatments are a little bit different. So let me talk a little bit about how that is. So cognitive behavioral therapy, for those who are not familiar, is really based on this premise that we have triggering situations or contexts that result in unhelpful thoughts and subsequently difficult emotions, and then behaviors that are not really aligned with how we want to live our life. And with a gut-brain therapist, we really zoom in on how this pattern looks in the context of gut distress. So an example, if we have a patient who wakes up in the morning and immediately feels that pain in their gut, their thoughts start to race. How am I going to make it to work this morning? I have that big presentation at lunch. Am I even going to be able to eat lunch? Because I already don't feel good. I don't want to eat during the presentation because then I might feel more pain. And if I'm feeling more pain, am I going to be able to present? And then the mind just starts to run. Consequently, this patient might feel worry, might feel sad, might feel frustrated and angry. And then perhaps what they do is they just go ahead and call out of work. They're like, I just can't even go today. I got to cancel this presentation. It's not going to happen. And what happens in this cycle is that reinforces that vicious cycle I described earlier and reinforces that nervous system activation that plays into these symptoms. So the brain learns, yeah, these symptoms are dangerous. We can't cope with these. We got to get out and get away from them. So in gut-directed CBT, we really zoom in on how can we shift some of those thinking patterns? How do we get your life back? So all those things that we're avoiding as a result of your GI symptoms, how do we get you back into those experiences, even if symptoms are present, to help reduce the reactivity of the nervous system? Now, gut-directed clinical hypnosis, some of you on the call might be like, what in the world? Woo-woo clinical hypnosis. I thought that was a thing of the past or outdated. Or perhaps for you all like me, I saw clinical or hypnosis, not clinical hypnosis, for the first time during my senior night in high school. They had like the football players on the stage quacking like ducks and doing really embarrassing things. That is not what we do during our treatment. That is stage hypnosis or entertainment hypnosis. We utilize clinical hypnosis. And what we're doing here is we're trying to help folks learn how to engage a very naturally occurring trance state. So for those of you who love audiobooks, perhaps if you're driving to work and listening to an audiobook, you get to work and you go, oh my gosh, I don't even remember getting here. I was so into my book that I don't even remember taking the exits or turning the car. Like it just kind of happened. If we have any athletes on the call, the flow state that folks get into, maybe when they're running or in the middle of a competitive game, that is also an example of trance. So this is something that's naturally occurring for all of us. We just teach folks how to utilize this to their advantage in terms of managing their gut health. So we, in these trance-like states, use suggestions really targeted at the gut to help promote healing and change and to reduce that visceral hypersensitivity and to reduce that hypervigilance, which can also help with things like pain management as well. Research shows that for individuals with IBS, these treatments together can result in relief for 80% of folks. So this is not the rates that we see for other kinds of treatments. This treatment is really effective and very powerful for folks. We see at least a 50% reduction in symptoms for that population. So we're really trying to get the word out that these effective treatments exist because folks are presented with so many treatments with IBS. You could get on any newsletter or listserv and get lots of different information, but we see such great results from CBT and clinical hypnosis.
Again, those are pretty astounding numbers. That's a huge,
Yes.
yeah, I didn't realize that the efficacy rate was so high.
Yes, yes. It's been shown too. We've seen multiple randomized controlled trials and meta-analyses. So it's been really well established in the literature, which is obviously really important. We want to be using evidence-based research-backed treatments. And these two are some of those for DGBIs.
It's really fascinating and interesting too how you described the gut-directed CBT, which is sort of similar to how we might approach CBTI for insomnia, cognitive behavioral therapy for insomnia. It's not your run-of-the-mill CBT protocol. It's a very specific protocol targeted at that condition, whether it's insomnia or the gut health. And so I could see parallels with both and how someone who's struggling with gut health and sleep issues could benefit from both of those specific approaches. I'm curious, with the clinical hypnosis piece, is that integrated into the CBT protocol, or how do you navigate both of those treatments?
Really good question. So we truly try to have them speak to each other. So in that suggestion portion of the hypnosis session, we incorporate things like sensations that used to bother you before no longer bother you anymore, or you notice them and you become less concerned and you're feeling more confident, for example. So ways in which we're shifting cognitions and responses to triggers, we are then kind of enhancing that and plugging that into hypnosis so that we're getting a double effect. It's magnifying the effect of CBT. So we really have them speak to one another in how we incorporate those suggestions in hypnosis.
Excellent. Yeah. So interesting. And I'm curious about your experience with sleep and what sorts of sleep issues you might be seeing in your practice, or how sleep might change with some of these interventions.
Absolutely. So I thought with this, perhaps I could give a case example of someone that I worked with that there was this really strong overlap between their GI distress and sleep and kind of how we use these interventions to support. So this individual was a middle-aged male who came to me for a combination of upper and lower GI distress. So a lot of GERD, distension, and constipation that was going on for about 3 years after a significant family stressor had arisen. All the GI workups were negative for organic causes. This person had a significant impact on their functioning, relationships, concentration, a lot of acute worry, fear. They wouldn't exercise. They were avoiding a lot of food. So life was really radically impacted by these symptoms. And notably, their symptoms actually flared a lot at night, right before bed. So these led to episodes of panic and hypervigilance around symptoms, and then subsequently a lack of sleep, because now they're up alone and they're struggling with symptom management, and then they're worrying about their lack of sleep. So it was like a double whammy for them at night. This person also wasn't fully convinced there wasn't a structural cause to their GI symptoms, so they were still kind of seeking out other answers or options to their treatment during our time together, which actually had decreased by the end of our treatment. So what we did together, we met for 14 sessions. So these are time-limited treatments. These aren't meant to be forever. And I used a combination of gut-directed clinical hypnosis, cognitive behavioral therapy, and then I'm also an ACT practitioner, so acceptance and commitment therapy. And we really decreased this patient's worry and fear related to symptoms. So we kind of helped track and notice the patterns in what is triggering your anxiety, what is your anxiety about related to your symptoms, and what is the impact that's actually having on your nervous system and your symptom experience, and then subsequently sleep. So we incorporated some sleep hygiene strategies, we incorporated hypnosis exercises, but what I did was I tweaked our recordings where I would stop my recording right before the re-alerting portion, so that when he would listen to these recordings at night before bed, he could just drift off to sleep as the recording completed. The recording didn't kind of bring him back to that awake state. This also helped him a lot at night if he were to wake up in the middle of the night and be experiencing acute GI distress. He would pop on the recording and they would help him with sleep onset again. So this was a really powerful tool for him for reducing that panic, reducing that worry, and then reducing those symptoms when they were appearing at night. We noticed significant reduction in anxiety and depression by the end of treatment. He was in the mild to moderate range when we started, and it was subclinical when we completed treatment. And then he also rated his severity and distress related to symptoms as 7 out of 10, and that went all the way down to a 3 by the end of treatment. So as a result, kind of that use of these skills, specifically in the context of sleep, really helped him get his life back. He was able to get re-engaged in activities that were important to him. His worry went down a lot more, and he felt more in control when those symptoms came up and was able to sleep, which we know totally helped in the long term as well around symptom management, as well as any emotional distress.
That is a really compelling case. Thank you for sharing that. And
Absolutely.
yeah, and I think it's a reminder too for people who are struggling with GI issues. So if you're seeing patients struggling with GI issues, often they're really focused on their diet and nutrition, looking for the next FODMAP diet, or should I do gluten-free or whatnot. And these things can be helpful for sure. So I don't want to minimize those. But there is this mind-body piece that is so important to address, both for gut and for insomnia issues. With insomnia, you're often seeing patients who are now looking for the next sleep aid or the next supplement or the next gadget that's going to help them.
Absolutely.
And not addressing that mind-body piece that's really perpetuating the factors that are contributing to that vicious cycle. So thank you for highlighting that case. It's really compelling.
Absolutely. Similar with sleep, as much as we'd love to say here's this like one perfect solution, there's a multitude of factors that can really influence folks' experiences of these physical symptoms. And it's understandable, right? They want to sleep, they want to not feel pain in their gut, or they want to be able to poop, that they want to find that thing that's the quick fix. I can totally understand that. And the more we can help them understand that it really is a more complex picture and getting more at the root of what's contributing to symptoms versus putting the Band-Aid on top with either that quick medication or quick supplement or quick diet, we'll actually be able to see change that's not only in the immediate, but in the long term as well.
Excellent. Where can people learn more about you?
Absolutely. So feel free to check us out on our website, www.gipsychology.com. Also, feel free to follow us on our socials. So we're on Instagram at GIPsych, PSYCHUSA. We're on LinkedIn. Find us on GI Psychology. And then on YouTube, we're at GI Psychology Mind Your Gut.
Well, thank you so much. I'll put all of those links in the video description below. And Dr. Joseph, you're able to see patients across multiple states, as far as I understand.
Yes. Yeah. So we're a totally telehealth practice. for this very reason of wanting to get folks access to this high quality evidence-based care. So we see folks ages 6 and above via telemedicine across all 50 states. If you're interested, we have a free 15-minute phone consultation for folks. I'll also share with Dr. Bhopal the warm handoff referral line. If you have any patients that you want to send our way, a member of our admin team will reach out to them directly to schedule a phone consultation to make sure they'd be a good fit. But yes, we're able to see anybody anywhere in the United States.
That's excellent. Such a great resource. And so again, I'll put all those links in the description below so people can connect with you. As we
Absolutely.
wind down, are there any last thoughts or tips you'd like to share with our audience today?
Yeah, I think you mentioned something earlier that are just small but powerful changes we can make in our practice, and it's asking the questions and opening the conversation. It's really hard for folks to ask for help in these areas. Talking about your poop and your gut is something that probably all of us were socialized from a young age to not talk about aloud. And I think the more that we can open these conversations with folks and help them understand that treatment is available, the more we have folks who are not suffering in silence. Or folks for them, we're seeing challenges in other areas of the body, right? Because our whole body is connected, that these systems speak to one another. So asking questions about what happens when they feel anxious. Do you ever get nauseous? Do you find that you're getting diarrhea? And being really pointed in some of that assessment in those questions can really have a big impact for how you're understanding folks' experience and getting them connected to the right treatment.
Fantastic. Well, thank you again for sharing your knowledge and expertise with our listeners today. I learned a lot from this conversation, and I think this is just such a wonderful resource for patients who are struggling with GI issues. And I know I'm seeing more and more of that in my practice. And then an announcement I have was that we're now offering sleep coaching and CBTI in my private practice, and we're able to see patients across all 50 states. So if you are seeing patients who are struggling with insomnia, that's a resource that you can avail of. And then, of course, check out GI Psychology for your patients struggling with gut health issues. Thank you again, Dr. Joseph.
Thank you for having me.